Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan.
And I'm Dr. Ruben Rubenstein out of Troy, Michigan.
We're here with our returning special guest, Dr. Anat Shlagman out of West Bloomfield, Michigan. Welcome back.
Thank you very much.
Good to have you.
Hi.
And so, Dr. Shlagman is a traditional naturopathic physician.
Yes.
Try to say it 10 times fast, right?
It's hard.
And so we spoke with you last time you were on the show about all sorts of different health topics. But let's just start off this time talking about pediatric care and, you know, the naturopathic model to pediatric care and what we do as chiropractors. And, you know, we know a misconception for us is that people only should see chiropractors for, you know, when they have a crick in their neck or their back is killing them. And we always tell people to think of a chiropractor almost like a dentist for their spine. You know, people see a dentist when they have a toothache or pain, but they also go to keep their teeth healthy. And most people never think about their spine until it hurts, unfortunately. So we encourage and urge people to see chiropractors for checkups to keep the spine healthy rather than waiting until there are symptoms. Now, how is your model as far as pediatric care as well?
I think that it's very important to have the kids on a regular regimen of, you know, good nutrition, good herbal teas or herbal intake, something to keep them daily strong to cope with whatever is outside. So it's not something periodically like if you're in pain.
So your kids were already how old when you got into?
My older kids were about like 9 and 11, something like
So 9 and
this.
11. So how did they handle the transition of, okay, now we're getting on these regimens and now we're changing our diet and changing our nutrition and spraying cayenne pepper in our mouths all the
So it was a whole process for our house. It was new things because I started reading books with the concept that I never knew about. I thought, you know, the cow is eating grass. I didn't know that the cow is fed corn and soy and it lives in box, basically. And then whatever I was reading, I was bringing it to dinner. We were talking about it, and you know, you can imagine our table like with regular stuff, American stuff. And I'm looking at the ingredients saying, you know, I was reading about this, this and that and that, and this, you know, today I will not take it. And you know, and slowly and gradually, my kids, you know, they get it in their mind. Kids are very smart. Mm-hmm. Kids, I understand, and you know, you don't need to pressure them into doing something. They need to understand why they do. And slowly I got reactions like, oh, you know, Mom, next time when you go to the store, don't buy this. Let's try something else. And slowly we progressed into stuff. And we decided that at home, this is what we have at home. Yeah. When you go to your friends, you do what you do.
Yeah.
And they used to celebrate there. They were eating everything.
Game on at
you
the
know,
friend's
it's
house.
like at the beginning because they didn't have it at home and they missed it. But they were paying. When they're coming home,
yeah.
There was aching and, you know, they were laying on the sofa for hours and they were getting it. You know, I don't need to talk. I don't need to say anything. They are getting it. And the more your body is clean, then you notice the pain. Because if we eat junk, we are in pain, but you know, nobody complains, so we think it's normal.
Absolutely.
But when your body is clean, it's much harder. So slowly, you know, they themselves said, oh, I'm not eating this anymore and this anymore. And then, you know, we reached the book about gluten. And I was like shocked. I said, I was so overwhelmed. I cannot do gluten-free in the house because, you know, it was already 6 months of changing. But I kept talking about it and I kept bringing it to the table. And then one day my son opens the cabinet and, you know, I have whole wheat this and whole wheat that and some cookies and the cereals. And he says, Mom, if all this is so unhealthy, why is it still here? And, well, take a good look.
Yeah.
Tomorrow it's gone.
Yeah.
And it was gone. And, you know, I was mostly afraid about cereals because what is much more simple to give a cereal to the child in the morning and you're done with breakfast. Mm-hmm. But it's not healthy. So then we moved to eggs in the morning and we moved to yogurt in the morning. And, you know, you find your own combination, what is working for you. And it went smoothly.
I love how you say you did the transition little by little, because that's what,
Completely.
even when people ask me for nutrition advice, I don't want to encourage someone to just go home, throw everything out, start from scratch, because people can't maintain that. People just don't have the discipline or necessarily willpower to want to do that or to do that. But even little by little, they can make a huge change over time. And would you say, of some of the first few things, I know you said, of course, gluten and sugar are the most important first things people should start weaning down on. But as far as, let's say someone starts to buy organic, you mentioned grass-fed compared to the other options. Would you say that's one of the most important or easy changes someone can make?
For beef, I would not touch anything else than grass-fed.
Yeah.
And I know, because when people think about it, for that one cow to get that 1 pound of ground beef, that cow had to eat hundreds and hundreds of pounds of sprayed grains and sprayed chemicals just to make that 1 pound of beef compared to the vegetable. So, if someone's going to switch from one thing first to go organic, if it's a price thing or out of convenience, start with the beef, start with the meat, because
Completely.
that has so much in it that made that cow the way it was.
And it's already processed in
Right.
it. And it's made the damage in the cow already, and you get the damage.
That's
from
brought
it.
into the molecular level of what
Completely.
this beef is actually made of, instead of, so that's a real important thing.
Yes.
So did you notice your kids after you started this, were they healthier
gosh.
and more energetic? And
They each one lost about 20 pounds.
Wow.
And they were so energetic, and they succeeded in all the sports that they did.
awesome.
And they were bursting with energy. It was
So
unbelievable.
they saw the results as well, because when they're better at sports, they realize something that
Completely.
was important.
and then
they-
their friends saw it.
Completely.
Yeah.
Yes. And they, and they wanted to be active, as opposed before that, you lay down on the couch and you're very tired after you eating so many carbs. And it's really, it's a huge change. You want to go out, you want to be active.
In your practice, do you have a lot of children that you deal with?
I have some children, and usually they come with the parents after
the
the
family.
parents are coming. And I love to work with family.
Yeah.
Because the change, you cannot make a change alone for the whole family. It's a whole process, and everybody needs to understand what is happening and why we're doing it.
And as you know, in our practices, both of our practices, we feel the same way, that we take care of many, many families. And I know, if you could maybe shed some light on your experience as a patient of ours, that bringing your children to a chiropractor as well.
Completely. It was an amazing change. Even in the kids, they all started to feel more straight. And even if they started to feel, let's say, flu coming in or something, immediately it shifted because, all the things kind of balanced, and it's shifted. It was an amazing change.
Because we're co-managing. You're doing making sure they're eating right and all that stuff, and making sure their immune system's good, and we're now making sure their nervous system's functioning right. So, I mean,
Completely.
if we can get together and co-manage patients that are under traditional naturopath physicians and under chiropractic, now we're talking about completely changing people's lives. From
Exactly.
the inside out and all around. We are making the patients all around better.
And again, we don't want to say there's, to rule out or anything that there's not a time and a place for any other, allopathic or traditional medical model. But
Yes.
again, to start natural and then work our way to the other things is always a good idea. To just live a healthier lifestyle rather than just jumping into maybe an easier fix with just, taking lots of different medications for lots of different things.
Exactly. It's suiting, I guess, people who don't want to change their life, who are okay with their lifestyle, and then, okay, I get an easy fix, and I fix the symptom, I feel better. But people who really want to work into themselves, really want to understand what's happening to the body and reach a completely different level of health, yes, they need to
So
go
a lot of the
first.
children that end up coming to our office start as the family. Mother or father may come in for a specific symptom or something like that, and then as we educate them, they understand exactly what we do, how important the spine and the nervous system are, and then they want to get their kids checked out. However, we do see a lot of kids that come into our office directly for certain symptoms. One particular one that I know can be very bothersome and burdensome for a lot of parents is chronic and frequent ear infections. We see, it can be very rough for the parents, very rough for the children, and it's nothing that we do that is to cure their ear infection, but by working with the spine, we can allow the body to work at an optimum potential and really help with something like that. So I'd like to go over to the wall, and I have a little diagram that I can explain that a little easier and a little better, and so we'll go over here and take a look at that. So have you ever been in an airplane and you feel the pressure in your ears, and the first thing you want to do is kind of move your jaw like that, open your mouth, and you feel your ears release? We have a couple of tiny little muscles inside the ear there, levator veli palatini and the tensor veli palatini muscles. Those are working to open that canal, help depressurize, which allows fluid to leave the eustachian tube in the middle ear. And so what can happen is if we have cervical subluxation or misalignments in the neck, then those muscles, so we start with the cervical subluxation. The next thing, the muscles, levator veli palatini, goes into spasm. When this happens, we have occlusion or blockage in those eustachian tubes. When they're blocked, they can't constantly do that draining, where the ears will drain the fluid. And then when that blockage happens, we can start to get effusion or fluid build up in the eustachian tube or in the middle ear. Now if you think of, let's say, a pothole outside. If there's a pothole with a little bit of water in it for a day or two, not a big deal. But if there's a pothole with water in it for months and months and months, well, it's going to get mosquitoes in it, and it's going to get dirty, and it's going to get nasty. And the same thing happens within our inner ear. We have fluid built up for a long time, fluid in the ears. Eventually, they're going to get bacterial infections, viral infections, and can cause all sorts of different problems. Well, the traditional way to treat that is, take a trip in and get a prescription for antibiotics. And so we start treating with antibiotics. Over time, those are great for bacteria, but now the effusion still persists because the muscles are still in spasm and we can't drain, so we still have fluid in the ear. So eventually the bacteria come back, or if it's a viral infection, antibiotics don't affect viral infection, so the viruses are still there, or again, the bacteria can regrow because the fluid is still remaining there. And then it starts this vicious cycle round and round and round. So what we do as chiropractors, we check the upper cervical spine, take pressure off the nerves so those muscles aren't in constant spasm. We don't have occlusion or blockage of the eustachian tubes, and then we don't get effusion or fluid built up in the inner ear. And we have some really awesome results with children in our office. Now, don't get me wrong, there's, again, a time and a place for all traditional types of medication and treatment for this, but if we can start from the root cause, we see so many different results with this. So what I'd like to do now is show a couple of little clips, some video testimonials from some of our patients that have had such profound results with ear infections.
Hello, Lila here she just turned 5 years old, and she has had problems with fluid in her ears since she was 8 months old. She had tubes placed at 8 months old, and then she had problems with hearing loss. When she was 4 years old, her tubes came out. She again developed fluid in her ears, ruptured her eardrums, had all kinds of problems, even more hearing loss issues. The ENT wanted to place tubes again, so instead of placing tubes, since we still had the hearing loss issue, we decided to try going to the chiropractor, and we are very happy that we go to the chiropractor now, because 6 months after being at the chiropractor, or even sooner I would say, she was hearing better. I just knew by the volume of the TV and everything. And then we went to the ENT earlier in the month, who said her fluid is completely cleared from her ears, her hearing is completely normal, they did the hearing test, and she does not need surgery. So we're going to keep going to the chiropractor, and that's pretty much it.
Hi, my name is Lori, and this is my son Will and my daughter Grace. We've been coming to Rodnick Chiropractic since August of 2011. That was 6 months ago. My son, the previous winter, when he was an infant and turned 1, got about 5 to 6 ear infections that year, and he had to be treated with amoxicillin and penicillin. Repeatedly, it wouldn't go away. They talked about putting tubes in his ears. Ever since we've been coming to the chiropractor, one moment, he has not gotten 1 ear infection. So it has definitely helped him out to not be on harmful antibiotics. And my daughter as well has gotten sick a lot less, and my neck feels phenomenal. So we just want to say thank you to the doctors, and we love Rodnick Chiropractic.
So we can see from some of those testimonials that natural, gentle chiropractic care can have some really profound results with some things that really make a lot of trouble for children and for parents.
Yeah, and that's one of the things we want to bring to our audience is let them know that there is another way. You don't have to go the normal route of drugs and antibiotics and putting tubes in the ear and putting your children through these surgeries. I mean, simple chiropractic adjustments can help relieve these issues naturally.
And again, not to say that there isn't a time and a place for all of those things, and there certainly is. However, let's say someone brought their children in and has really bad ear infections. We may have amazing results, but let's say, for example, maybe we didn't on that person. They can still go ahead and have the medication. They can still go ahead and have the tubes and the surgery.
That's what we're saying.
Didn't lose anything from that.
And it's okay to question the doctor. It's okay to look somewhere else and be different from other people who just go straight to the doctor.
Yeah, a lot of people.
Like it's okay, like how you said that. It's okay to question the doctor. It's okay to question the
Us,
naturopath, to question the
completely.
chiropractor, to question the
Yes.
surgeon, to question everybody. And we encourage patients to be
Ask
proactive
questions.
about their health rather than just blind faith, do whatever, not take care of
Because
themselves.
otherwise we just replace the doctor. But if we encourage them to ask questions, we encourage them to read about something and let's talk about it. What did you read? What did you understand about what you read?
Yeah.
Let's see how we can promote it in your body. Then it's a completely different process.
Yeah, let's find out why they came to the solution they came to.
Completely.
Why they picked that route versus the other route. Let's sit down and talk about this before we jump into whether you're going to the naturopath, whether you're going to the chiropractor, whether you're going to the medical doctor. Let's sit down and talk about why you came to that route.
Yes.
And I mean, if we can sit down and figure out, okay, well, this is the way my parents did it and their parents did it and their parents, well, is that really necessary to continue that route? So I think that's a good way of managing a patient.
And even when you think like this, you start thinking, who can help you? Because, there are, only the doctor, but there are so many health professionals in the non-regular way that can help you, and you can choose
And
whoever.
one easy way for people to look into information is just look on the internet. Just search, what are options for this? What are options for that? And that's how we try to do, things like educate people on television and educate people online, things like that. There's a lot of information out there that people can get if they just look for it.
Yeah, if you go to thrivechiropractictroy.com, there's a lot of information on children and chiropractic and a lot of information on chiropractic as a whole, because there are a lot of misconceptions about what chiropractors do. We mentioned that chiropractors, most people think that they only go to a chiropractor when they're in neck pain and back pain. We actually brought a little chart that I'm going to go over to on the wall and explain how chiropractic deals with the whole autonomic nervous system. So we'll go to the wall right now. So as we were saying earlier, a lot of people do have the misconception that chiropractic's all about back pain, neck pain. But I'm going to go into a little more in depth about how we deal with the whole autonomic nervous system by making sure that the spine is in proper alignment. So your brain controls all functions. Starts from the top and works its way down the spine and the nervous system. If all functions of your brain run through your spine and the nerves coming out of your spine, and there's any misalignments causing an interference from the signal, then for any of the organs of your autonomic nervous system to work, they're not working at a proper 100% function. So even for your heart to beat, your lungs to breathe, and your digestive system to digest the food you had this morning for breakfast, it's because the brain is sending signals down your spine through your nerves to those organs. Now, if there's any interference, they're not getting there properly. So people could have heart problems. The leading cause of death in America is heart disease. You'll see marathon runners dropping dead of a heart attack. Why? They look like they're the tip-top shape of their life. Best shape, they can run 26.2 miles, but all of a sudden something happens. Is it because the signal from their brain to their heart is not functioning properly? It's possible. So in chiropractic care, we remove the interference from your brain to your organs to make sure that all things are functioning at 100%.
So there's a lot more to it than most people really would think on their first impression.
Absolutely. I mean, they don't think about the things that I just mentioned. It just that doesn't work. In their heads, they think about the back pain, neck pain.
I would start, they don't think. Because they are used to kind of the model of the parent-child model, that I am coming to the doctor and, okay, you know, hey, doctor, take care of me, and look at me, I'm so miserable. But when we go to a more co-creative model, then we start thinking, and then we start operating and using what we have.
So let's go into more of the traditional naturopath things that you deal with. I know you deal a lot. I know it's very important for everyone. They tell you, oh, you want to get 8 hours of sleep from you're a tiny little kid. You want to make sure you get that. Explain the sleep methods.
First of all, you know, when you go to sleep, you need to sleep. Many people think that they are sleeping, but when they're waking up in the morning, they are not really relaxed. Mm-hmm. And this is part of the things that we need to relax our nervous system. So what I advise many of my clients is to put castor oil on their belly, and it's kind of with a hot water bottle, it's working straight on their nervous system. It's kind of taking them out of the survival mode and relaxing them, and it gives them a whole deep sleep. So when they wake up in the morning, they are, even if they slept 4 hours or even if they slept 8 hours, but they slept.
It seems to help with the transition between sympathetic and parasympathetic nervous
Completely,
system, right?
yes.
Some people may have heard those terms before, sympathetic nervous system and parasympathetic. I can explain those briefly. They kind of nickname sympathetic fight or flight. You know, if somebody is going to attack you, pupils dilate, blood rushes to the muscles, blood rushes away from the digestive system and the reproductive system, and tries to make you run faster, jump higher, be able to fight. Parasympathetic is the opposite. It's what they call feed and breathe. It's when you digest your food, your reproductive system is working. And so you don't want to be going to sleep where your sympathetic nervous system is firing. You're not going to get as good or as restful sleep. It's not going to help regenerate the body as well. So something like castor oil, you say, is something that helps people transition from sympathetic
to the parasympathetic.
To parasympathetic.
That helps them get into the REM sleep cycle?
Yes. And it's nourishing all the other
it's good for the liver too, right?
To the liver and to the digestive and, you know, to the bowel movements. And it's actually, you know, those systems don't work when you are on the sympathetic system. Mm-hmm. So it's bringing everything back. It's starting to nourish whatever didn't work. It's nourishing even the reproductive system. So people, when they are calm, they can do
So it's
stuff.
good for the people that said, hey, I slept 8 hours, but I'm still groggy.
Completely.
Why am I groggy? I got my 8 hours of sleep. You're supposed to, after 8 hours of sleep, wake up feeling refreshed.
Yes.
So that's...
And sometimes you take some herbs like to relax your nervous system, and then you feel like you want to sleep and you're kind of dropping dead in the middle of the day. But it's not like the herb is doing something to you, like it's killing you. Mm-hmm. The herb is just showing you how tired you are, how exhausted you are. So it's forcing you to sleep. So you sleep and then you can feel better.
And there are all sorts of other different flushes and cleanses and things like that you recommend to your clients as well, right?
Completely, like liver cleanse, because many of my clients, you know, they went through many drugs through the whole life, and everything is processed by the liver. So, you know, when they start to adjust to a new way of life, I recommend to do a flush or a liver flush.
They can do things for not just liver, but kidneys and all sorts of other things, digestive system.
All the eliminations channels need to be open.
Explain to the audience real quick, what does the liver flush consist of?
Lemon, olive oil, ginger, everything, you know, very natural. It's kind of a blend that you mix in the morning and you drink it. And this is basically your breakfast. Mm-hmm. And garlic. I forgot garlic and cayenne pepper. And it's helping the liver to start releasing the biles, to start moving, and it's
functioning
amazing.
Properly.
Yes.
Allowing their liver to function. After all those years of putting junk into it, now we're doing the cleanse to allow it to function.
Yes, and that's something that you said, someone can still live their normal lifestyle and eat normal food, and they just add that in, right?
Exactly.
It's easy to add in rather than
change your breakfast.
Get rid of everything. Right.
Yes, for 10 days, and then you are a new person after 10 days. It's amazing.
Do most of the
I know, I want to do it.
Yeah, I'm gonna. We can't try that right now on the show.
Yeah.
Maybe by the time the next episode comes.
It can be an amazing transition in your body because it's even emotional and the mental, you know, transition, and it can be amazing because the liver contains emotions and it contains all kinds of, you know, anger and fears, and you can be more angry or start screaming on people, but it's good because you take it out and it's not staying inside.
Well, thank you so much for joining us today. That's about all the time we have today. Again, this has been Ask the Chiropractor. I'm Dr. Adam Rodnick out of Commerce Township.
And I'm Dr. Ruben Rubenstein out of Troy, Michigan. Stay pure, Michigan.
We'll see you next time on Ask the Chiropractor.